Good morning. Thank you for joining us. Today we are joined by our Senior Public Health Officer, Dr. Patrick Ludke. Before Dr. Ludke comes up, I'd like to give you an overview of our schedule, how we're going to be doing these press briefings going forward. You've likely noticed us mixing it up from time to time with various guest speakers, and we've decided to do that now on a schedule. So every Monday we will hear from our Senior Public Health Officer, Dr. Ludke. He will be talking about a variety of different issues from that medical doctor and public health officer perspective. On Wednesday, we're going to try to do our partner agencies and hear from various partners in the community and the good work that they're doing. And then on Fridays, we're going to be doing our elected officials and hearing from them. So we're going to stick to that as much as possible. Our off days, Tuesdays and Thursdays, we will only be doing our typical briefing. So at this time, I'd like to introduce our Senior Public Health Officer, Dr. Patrick Ludke.
Thank you, Jason. Pleasure to be here and discuss a few topics to move us forward. First, I want to talk briefly about masks. There's been some confusion about using masks, some clarity, I think, about using masks in the broader community. And this is not unique to our current pandemic. There has been confusion with mask use for many years, actually. Immediately after the SARS epidemic in 2002, 2003, a flurry of studies were run on how well masks prevented any disease in the lay community. Now, this is not mask use in the clinical community, in urgent cares and clinics and hospitals. This is mask use out in the community, going to grocery stores and restaurants and things. And some of those studies showed that there was a small amount of effectiveness. Other studies showed that, unfortunately, there was not any prevention of disease. And the challenge, of course, is that using these masks appropriately over a long period of time is difficult. Many of the studies showed that half of people or more did not use the masks appropriately. And I suspect many of you watching today have seen people have masks only over their mouth, not over their nose, or perhaps the same mask was used for days and weeks, and it degraded over time, and those are all challenges. So the net thought, immediately after SARS, a related virus to this COVID-19 virus, and immediately after the MERS timeframe, MERS came out in 2012. Some of you may not have heard of MERS. It's Middle Eastern Respiratory Syndrome, also a coronavirus. The immediate thought was, well, in the general community, mask use is probably not overall effective. Now, you recently heard last week, the CDC has changed its recommendations. And I'm going to read what they actually are so there's clarity. If one cannot maintain social distancing, consider the use of a cloth mask, especially in areas of significant community-based transmission. So areas of the country clearly have significant community-based transmission. We heard about Seattle in the month of March, New York City certainly now, parts of California. We have community transmission here, not high level yet, but it probably will become higher over time. And use of a mask in a community during these high-level transmissions is probably of some benefit, especially if you cannot maintain social distancing. So if you find yourself in a place where you're elbow to elbow with someone, perhaps at a checkout at a grocery store, there may be benefit to using a mask there. I wish we had better science to say it's absolutely of benefit, but considering its use is something that we are recommending now. Next, I want to give an update on new things we know about the SARS virus over the 14 weeks or so we've been aware of its existence on planet Earth. The first is we now have some studies looking at treatments. And I suspect some of you have heard about reuse of these malaria drugs. We're gathering data on some of those drugs. There have been some interesting publications just in the last 3 or 4 weeks showing that there's some effect. We don't have great studies. In a perfect world, we'd have these wonderful randomized, placebo-controlled, double-blinded studies. We don't have any studies of that high quality yet, but we have some studies that are being done without control groups showing that there's some effect. So several medications, chloroquine, hydroxychloroquine, you probably heard those names, a common antibiotic to prevent that secondary bacterial pneumonia that can cause severe disease after coronavirus infects you, called azithromycin. There's some studies on that as well. And then some interesting studies on these drugs that prevent what's called a cytokine storm. That's probably a little too scientific for many, but sometimes when you have an infection, your body releases a lot of chemicals to pull in white blood cells to really fight the infection. And sometimes that robust fighting also attacks yourself. And if you can slow down that or decrease it a bit, you'll have less damage. So there's a good deal of studies coming forth in those sort of cytokine arenas. Also, we've learned a bit more about the spread. So we still believe that the vast majority of transmission is from these large droplets that fall within 6 feet of people when they cough or sing or sneeze. However, it looks like there's a little more transmission from contact and perhaps even from airborne than we were originally aware of. But more importantly, we think there's asymptomatic transmission. So last week, the Center for Disease Control changed the recommendations for our contact investigations at local health departments, where we now go back 48 hours before somebody had symptoms and find out who they had contact with. So again, those contact investigations help us understand who may have been exposed and how we can prevent them from becoming ill and spreading it to others. And typically, before last week, we started that right at the time of symptoms in the index case. But now we go back 48 hours. So that's a change, and that's because we've gathered new data that says that would be wise to do. Finally, in terms of updates, we're looking very closely at ways to look at infection prevention in the environment. So we know that when you cough or sneeze, these large droplets come out and the virus can land on things. It can land on this lectern, these microphones. It can land on your countertops and tables, etc. And that's why we recommend environmental cleaning with these EPA-approved products. But we're also looking at broader ways and use of things such as ultraviolet C. It's a special form of UV light that is blocked by the atmosphere, so it doesn't reach the ground. We're thankful it doesn't, because we'd get one heck of a sunburn from it. It's not the UVA, UVB that gives us sunburn. It's blocked by the atmosphere, but it really is potent and can kill viruses and bacteria. So there are special light bulbs that create UVC. We're looking at uses of that. It's already used in operating rooms and in some cancer clinics because persons with cancer are very fragile. So we're looking at using that more broadly. Also, there are other products we use in the laboratory world. One is called VHP, vaporized hydrogen peroxide. I use that in the lab I used to work in. Works very, very well. Kills all sorts of entities, microorganisms, and it can get into cracks and corners because it's a vapor. So we're looking into those as well. Lastly, I want to look at testing. I think there's been a lot of frustration around testing. I share that frustration with you. There has been a shortage of molecular tests in this country that has really made it hard to understand the spread of this epidemic and understand what we'd like to know from an epidemiological standpoint. We're fortunate now that more clinical laboratories are coming online, and I'm actually heartened to know that our public health laboratories have really played a big role in that. In our state, we have one state public health laboratory. They have provided what are called validation panels. It's a group of positives and negatives, and they give them to the clinical labs as a test. And if the clinical laboratory gets the answers right, then they are able to report with a new test that they had never had before. So our state lab has done that for multiple clinical laboratories in Oregon, which is a wonderful thing, getting more labs to help. At the local level, here at Lane County Public Health, we're working closely with other entities, both in the research arena, to try to get some of those research labs that are doing these fancy tests, but perhaps doing them for other purposes, to focus now on human testing instead of, say, on animals, or perhaps environmental. And also, we're looking at other ways that we can work with clinical laboratories to repurpose some of their existing equipment, and we've been helping a fair number of those facilities that have clinical laboratories to envision how they could help in this arena. Finally, I guess two things. We want to make sure that any entity that begins testing reports to public health. We want those test results. We have a dearth of test results that we can really provide actionable epidemiology on, so every test result could mean something new to us. So we're working actively with those entities that are bringing up laboratory tests to make sure they report to us, and then we can jump on it right away with contact investigations. And then I want to talk briefly about serology testing. So all the SARS testing and the coronavirus, COVID-19 testing that we have seen so far has been this molecular testing, where you actually test for a piece of the virus. And serology testing is where you test for the body's response to it. So these are antibodies that the human body makes. And some of those antibody tests are coming on the market right now. The challenge is we don't really know how well the human body responds to this virus initially or over the long term. And to best use those tests, we really need to understand if we make one antibody when we're acutely sick, how long does that antibody stay around? And then if we make a different antibody that provides immunity long term, so we can't get infected again, when do we make that antibody, and how long will that stay around? Meaning, how long will we be immune? So we are looking closely at those products coming on the market, trying to work with our clinical entities to figure out how it is they can best be utilized. It's an ongoing conversation with all of the hospitals and urgent cares and clinics that have labs in our community. And we are really, I think, heartened that we're going to be able to use these tests in a meaningful way to understand better perhaps what a second wave might mean. Well, that's all that I have now. Thank you for listening.
Thank you, Dr. Ludke. And I'd also like to thank our ASL interpreter. Every day when we get started with these press briefings, our ASL interpreter has about a minute to review talking points and then figure out how they are able to sign words like epidemiological. And so I'd like to acknowledge just the strain and unique challenge that our ASL interpreters are presented with on a daily basis. So thank you. I'd like to start off briefly with a case overview. To date, we have 30 cases here in Lane County, 30 positive test results. We have approximately 985 tests that we know about that have come from Lane County to our various labs. Again, with the caveat that that number is likely higher and now exceeding over 1,000 individuals tested. Of that number, we have 5 individuals who have recovered. And again, our definition of recovery is someone who has not had a fever for 72 hours or a cough for 72 hours with the aid of medication. We have 6 individuals who remain hospitalized. We still have only 1 fatality, and we have 18 individuals who are sick at home currently. Over the weekend, we announced a few cases. We added to that number today. I'd like to give you a brief overview of those cases. We have a female in her 80s from the Eugene-Springfield area. Unfortunately, this individual is currently in the hospital and in the intensive care unit. We have a female in her 30s from the Eugene-Springfield area who is medically stable and currently at home recovering. Now, this one is an individual or an interesting case because this is a known epilink or epidemiological link to an existing case. So that's that public health work in action, identifying that piece and then doing contact investigations from here. And we're able to create that spider web of connectivity, which is important in helping us respond through a public health way. We also have a female in her 30s from Eugene-Springfield at home and stable, and we're still investigating the link there. Of the new cases that were just identified today, we have a male in his 40s from the Eugene-Springfield area. He is at home and medically stable. We also have a female from rural Lane County who lives in a private residence and is at home and medically stable and following all Lane County public health guidance. A couple other announcements to make really briefly. We have Spanish language translation now available on these press briefings. That will happen towards the end of the day of the day's press briefing. It just takes a while for us to do the captioning on that. We thought the captioning really is the best way to go. So that is now available. If you want to utilize that technology or those captions, look towards the end of the day on our Facebook page, and that will be available. And we will also be sending that out through the typical way via email, the link thereof. We're also doing a Spanish question and answer with our Deputy Public Health Officer, Dr. Alessandra Guzman. She will be doing that Q&A on the Central Latino Facebook live this Wednesday, April 8th at 1:30 p.m. And so that is a great resource for individuals whose primary language is Spanish and would like to hear a lot of the important information that we've been sharing firsthand from a doctor in a question and answer format live. Again, that's this Wednesday, April 8th at 1:30 p.m. on the Central Latinos Facebook page. We also have a new dashboard to announce. I'm going to show you what the dashboard looks like. There's a couple different elements to it. So the first element really is just a breakdown of our cases. This is going to be updated at the same time that we send out our press releases every day with the case numbers. So for individuals at home, you'll be able to access this data throughout the day and see in real time as we update that. So it'll have our case numbers up here along with the other stats that I report out on daily. Our recovered numbers, our hospitalized numbers, our deaths, our resting at home. We also have a gender breakdown, so females and males currently at 13 and 17. We also have our rate of cases per 100,000. That's a special way of classifying cases that helps us compare ourselves to other areas. And then we also have our deaths per 100,000. And then we've broken our cases down by age group, so you can track on what the predominant age group is that's experiencing the illness and being tested positive here in Lane County. We also have a graph on there that is our epi curve. So we've talked a lot about flattening the curve. We've talked a lot about exponential growth, and all that is captured, those terms, and being able to visualize that in this graph. So this is actually our epi curve here in Lane County, and you can see the way it breaks down on our case numbers, when those cases were reported, and then the corresponding curve. So in terms of being able to track where we're at on that curve and look at that at a macro level, this is really a great resource. And again, this is available on our new dashboard. Additionally, we have our testing numbers. And so that, I've shared this a couple times last week, it shows our test results and also our general testing numbers. So you can track with that and see how our test numbers are improving in terms of the quantity. All that is available on our website, on our coronavirus website. If you go to lanecounty.or.gov/coronavirus, there is a banner right there on the front page that has testing resources and other info. Click on that and it'll take you to these dashboards and you can keep track. Finally, I'd like to go over our plan. This is a plan that we reiterate through our Emergency Operations Center, where our focuses are for the week and how we're reacting to COVID-19 and responding as an emergency response. So the first is to contain the spread of disease. We're doing that through helping our community stay home and stay safe, as well as also doing those contact investigations and really trying to coordinate that data in order to be able to have a concerted public health response. We're making sure that our healthcare providers are heard and that we're taking care of them in terms of PPE and delivering the latest recommendations and guidances from the Centers for Disease Control. We're minimizing the economic impacts on our business community to the best of our ability and looking into the individual and specific needs of various businesses and continuing to work on some of those funding pieces for local businesses. And then obviously the public information and guidance, trying to make sure that we have the latest up-to-date information for you and are keeping on top of that in the way of press briefings, social media, web resources, and working with partner agencies to get that information out. At this time, I will take any questions from members of our media. I will take whatever I can, and I'll try to go through ones that I can field. And if there's any for Dr. Ludke, we will then switch, and he can address the ones that I do not address.
Kennedy with KEZI, what information can you provide us about the possible peak Oregon could experience?
So this is Kennedy from KZI. She said, what information can you provide us about the possible peak that Oregon may experience? I think this would be a great one for Dr. Ludke to dive into, but I will take a very brief stab because essentially most of the information I'm sharing with you came from him. And so that peak, really what we've zeroed in on is the need to first off use a variety of different models. Those models are looking at the overall situation from different perspectives, but one commonality is excluding the Portland metro area in our calculations so that we can really look at a more accurate view of Lane County. So again, just to reiterate, this is not a Lane County specific model. This is looking at all of Oregon excluding the Portland metro area. And that data has been compiled to calculate a rough date of sometime in early May, towards the end of the first week of May, May 6th, May 7th, May 8th, somewhere in there. And again, what we're going to probably see is a growth in cases up to that point. And then we're going to reach a zenith at which the case numbers won't necessarily continue to go up. but they will plateau off. So another important part of that is that they won't also go down. They will stay constant for a period of time. So things will seem as though they are not getting better. And we need to be clear about that for folks, that is what that plateau, that flattening of the curve will look like. And it'll stay that way potentially for a few weeks before it starts to go down. So that's the level of detail that I can give you. Certainly Dr. Lutke can go into more detail, but first I want to take any other questions we might get.
Alex Hassenstadt with KVAL, what are recommended materials for DIY masks, and where and when should people be wearing masks?
So Alex from KVAL, what are recommended materials for DIY do-it-yourself masks, and when should people be using those masks? And so I can answer this again. This is another one for Dr. Lutke to weigh in on. But so far the guidance that we've seen is that a cloth mask is really probably the best way to go forward, because then you're not using those procedural masks or surgical masks that need to be saved for medical personnel. And there's actually a really great video from our Surgeon General on how to make a quick and easy mask out of 2 rubber bands and a piece of cloth. But any cloth really that's folded back over would suffice to the most basic use. If you're able to insert in a vapor barrier, which is an additional piece of ventilated cloth, that can be useful as well. There are plenty of online resources that folks can access on how to make these. A bandana, a scarf, anything that really blocks that initial large droplet spray that comes from sneezing, coughing, or even talking can be effective. I think it's really important that folks understand that you need to wash these masks. That's why cloth can be a beneficial material to use. Is something that you can wash over and over and make sure that you're not breathing back in the same moisture droplets that you just exhaled. In terms of the settings that we are recommending that people use them in, the specific recommendation from the CDC is in settings where social distancing cannot be maintained. And so what we've heard locally is that there are some grocery stores where social distancing cannot be maintained. So that would be an example of where you could potentially help out by wearing one of those masks. And we also heard one of our health officers here in Oregon, who's a great partner of ours, Dr. Jim Shames from Jackson County, really put it well, I thought, when he said that by wearing a mask, I protect you. By you wearing a mask, you protect me. And that's really the ethos or the thought behind these masks, is that we're helping protect each other from asymptomatic transmission, and then potentially, if you are experiencing symptoms, from getting other people sick. And that's really one of the most important things for us to remember about the usage and the effectiveness of these homemade masks. And with that, I will let Dr. Lutke address the same topics that we just covered in more detail and from a more educated perspective.
So if I recall, the first question was about when will we peak? And I think Jason captured probably one of the key sort of pictorial parts of it well, is that we're often accustomed to the seasonal influenza year where we get a sharp peak. And we know that in any given year, it might be January or February, and we get this really sharp peak looking like one of the mountains of the Alps or the Cascades. And we really do believe that the social distancing measures we put in place and the closures of bars and restaurants and other facilities is going to blunt that peak significantly. So it really is going to look more like a plateau. And that visual, I think, is a good visual to keep, because plateaus might stay a plateau for some time. If you think of a plateau in the desert Southwest, with the red rocks, it's flat and it's pretty broad. So we're going to have several weeks of a plateau, and it'll probably be sometime maybe late April into May. We're not exactly sure. The virus still has some control. We're not controlling it, but it will be sometime in the next several weeks, and it will last a few weeks too, and then it will slowly tail off. Now, I suspect someone at some point will ask about a second wave. We can't predict that, but we may have another situation to deal with sometime later. And the second question, could you remind me, please?
It was about materials for masks and when and where to wear masks.
Yeah.
Like for the DIY.
Yeah, materials and the types of masks. So I think that Jason and I tried to tag team this, and I think we did a pretty good job. The CDC recommendation is now for use of these cloth masks out in the community, if you are in a space where you reliably cannot maintain social distancing, it may be helpful. And keep in mind, you still have to use it correctly. So you have to cover your mouth and your nose, and you have to use it the whole time. You can't just say, oh, I'm a little hot and I'm going to take it off my nose or that sort of thing, because you could be exposed during that time. So when you cannot maintain 6 feet of social distancing is the time to use it. Most any cloth will work, provided the weave is pretty tight. And I do recommend going to the CDC website to take a close look at the recommendations, because there are methods and patterns on how to make them.